Hello, good evening, and welcome to Cafdil Healthcare here on Cafdil Television. My name is Kojo Arthur. Tonight, we are diving into a serious but often overlooked condition, and that is glaucoma. We're going to know what glaucoma is, the causes, and how we can prevent ourselves from getting those diseases. My guests are seated already, and I will introduce them right after this break. Stay tuned.
The reason that glaucoma is important is because it causes irreversible blindness. The way the eye works is light comes in through the cornea and the lens, and those structures focus the light on the retina. And the retina, it's able to convert the light to an electrical impulse. And that electrical impulse is sent to the brain via the optic nerve. So when that electrical impulse gets to the brain, you are seeing the light and seeing that image. Glaucoma is a disease where the optic nerve gets thinned out over time. So when the light is coming into the eye and getting sensed by the retina, if you have glaucoma, then part of that retina and part of the optic nerve aren't working anymore. And so that light can't get to the brain, and that part of your vision, that part of your visual field isn't getting to your brain, and so you're not seeing that. A lot of people, even with moderate glaucoma, might have some vision changes, but they don't notice them. At later stages, the peripheral vision can be quite narrowed in, and the patient just has a central island or center part of that vision. But often, even people with just that island of vision don't have a dark or tunnel vision sensation because the brain is filling in that vision. It's filling things in based on what they're seeing in that center part, so they're going to miss things to the side. This is especially concerning for people who are driving because they won't necessarily see cars coming or pedestrians to the side.
Welcome back. If you just tune in, this is Cafdil Healthcare on Cafdil Television. I hope you would follow us on all our social media handles. That is Facebook, Cafdil Cape Coast, and also YouTube, Cafdil EDU. And my guests are seated already. I have with me Theophilus Ochre. He is an optometrist from Cape Coast Teaching Hospital. Doc, you are welcome.
Thank you.
So I didn't add Dr. Theophilus. I should have added that.
Mm-hmm.
And also Marian Ehun Arthur, my namesake. She is a ophthalmic nurse. I hope I mentioned it correct.
Yes, sir.
Yeah, Cape Coast Teaching Hospital. And also Prince Fianco, ophthalmic nurse, also from Cape Coast Teaching Hospital. Ladies and gentlemen, you are welcome.
Thank you.
Mm-hmm. Good to have you today as well. And glaucoma, we may have heard the name, but we don't actually know what is it. Let me start. They said ladies first, right? Mm-hmm. So let them start from you. When you say glaucoma, what is it and how does it affect the eyes and vision?
Okay, thank you so much. Greetings to your cherished viewers. When we talk of glaucoma, it's simply a group of eye conditions that come together and then we name them glaucoma. When we go into details, we say that glaucoma is a condition, an eye condition that affects the nerves at the back of the eye, which connects to the brain. Mm-hmm. And then when this condition starts, it doesn't affect the nerves straight ahead. It starts at the periphery, the side and side of the nerves, the side and side of the eye. And so gradually the patient or the individual begins to lose the sight or the vision of the side and side.
Okay, so if I'm adding up to what she's saying, let's use this illustration as an example. Like you have bright light in this room. So the light represents the eye, what we are seeing. You have cables that are all wired up to a certain switch. So the cables are the optic nerves. So they are connected to a switch, the switch being the brain. So you expect that whenever you switch on or you go to the switch, you turn it on, you should get a light. But then there was a day you came to the office, you turned your switch on and there is no light. What is happening? That's what glaucoma causes. So you turn on your switch, that is, you're expecting to interpret whatever you are seeing. But then the optic nerve is telling you that, no, I can't see anything. I can't send any signal to the brain. So you turn on the light, the switch, then all the cables that you've wired up to your light source, they are all destroyed. So at the point, what she was saying, that you realize that your vision, usually peripheral vision, they are all going down. Most of the times, patients wouldn't notice that they are experiencing anything like glaucoma because, as she said, it's a silent thief of sight. So you'll be here having the condition, but nothing at all. You wouldn't even know that you have the condition. So most of the times, your peripheries, you'll be losing the vision from your peripheral side. Let's say about 180 degree. So when I'm looking straight ahead, like looking at something straight ahead, I'm expected to see some things at my peripheral side. But because I'm having glaucoma or the nerves are damaged, I can't see those peripheries. So unless it's central, that's what happens.
So in a semicircular form, so which means when you are looking, you should be able to see here and here at the same time.
Yes.
Because of 180 degrees.
Exactly.
So from here up to here, whatever is there, you should be able to. So if you are unable to see here, which means you are getting that, right?
Yes.
Oh, okay. So what is the global, give us the global picture, I mean the prevalence about this glaucoma.
Okay.
Then we narrow it down to Ghana as well.
Okay.
Yes.
Okay, so what makes glaucoma a condition that needs attention is that worldwide, 78 million people worldwide are suffering from glaucoma. So it makes it a condition that needs much attention. And then we have a projection that by 2040, over 100 million people are likely to suffer from glaucoma if they don't seek. By 2040.
40.
By 2040.
100 million.
100 million people
In the world.
In the world are estimated to have glaucoma. So it makes glaucoma, if they don't seek early attention, it makes glaucoma a condition that needs much attention. And what makes it difficult is that glaucoma, if you get it, is irreversible. It's not like any other eye condition that when you get, we give you treatment and then it goes away. For instance, if you have malaria, okay, if you have malaria, we diagnose you of having malaria today. We give you medication and then it goes away completely. But glaucoma is not like that. If you are diagnosed of glaucoma, it's irreversible. You are going to be on drugs till the rest of your life. So glaucoma is a condition that we need to take serious attention.
So if you wanted to
let me add up to what he said. We're talking of the nerves. So when the nerves are damaged, it's irreversible. There's nothing that you can do about it. It is.
you can't cut the nerves and join them.
No.
Just like doctor used wires as an illustration. So I thought wires, when they get when they break, you cut, you join.
It can never be rejuvenated. And so what we can do to help is to maintain where the deterioration has ended. Then we take it up from there and then give you the treatment to maintain whatever nerves that is left for you.
You've given us the global picture. Tell us what is happening in Ghana, and you come down to Cape Coast as well.
Okay, so in Ghana, a study that was conducted somewhere in 2019, it says that we have about 700,000 people having glaucoma.
So hold on, you said world, the whole world, we have
78 million.
And out of the 78 million, ours is
700,000. And of the 700,000, we have about 60,000 of them who have gone blind. And about 360,000 of them, they don't even know that they have the condition. You see, we have a system where few people attend the hospitals. So this is a survey that happened at the hospital. So what happens to our colleagues, our brothers and sisters, our mothers who are in the villages? who don't seek health care. We don't even know, we don't have data on them. So it's quite serious. And once, my sister said, once the nerves had gone, that is it. We have a fancy adage, mambo is in ways called kakrana wakano near Bohomban. So if it happens, you get glaucoma, you don't even seek early treatment. You don't come for screening, and then we don't identify that this person may have glaucoma or is having glaucoma, and then we don't initiate the necessary treatment now or management now. It means the person goes blind and there's nothing we can do.
So let me ask, what are the primary risk factors for developing this glaucoma? Though?
All right. So the risk factors, we are Africans, and the most unfortunate incidences, Africans and Asians, we are prone to having it, and also runs through family. So if my dad or my grandfather, my grandparent, they have glaucoma, there's high possibility of me developing it. So that's also one condition. And then the other thing is our brothers and sisters who are myope. Myope means that someone who can see things clearly at near, but when things are far, they can't see. They also have a potential of developing the condition, glaucoma.
Hey.
And then to add a little up, those with chronic conditions like diabetes, hypertension, those people too are prone to having glaucoma. And then there's this thing about Africans or Ghanaians that we don't walk in and say we want to have our eyes checked. It is, we only come in when we have a problem. So some mostly come up saying, my eyes are itching, my eyes are red. And then when you do the assessments, it is later that we'll find that apart from those itching, those allergy, those things that he or she is saying, we'll also see the back of the eye that things are not going on well. So mostly our diagnoses are based on not people walking in directly that they have symptoms of not seeing well, but they come up with dryness or itching or something else before we are able to diagnose that the person is having glaucoma.
And to add up to what my brother and sister said, it also affects all ages. So you have people, young people born with glaucoma, okay, and then, but for our part, advancing age, once you are aging to, you are likely to suffer from it. And then people who abuse steroids, too, are most likely to also.
What do you mean by that?
Steroids, yeah. So we have medications. Some people use it to bleach. Some people will go to the drugstore without giving any prescribed medication.
So you mean bleaching? Did you say bleaching?
Yeah. So some of the components of those drugs, they contain high steroids. Okay. So once you are taking in, you are using it on your skin and all that, you can get glaucoma. Yes.
And not only that, if there is also trauma to the eye, it leads to build-up of pressure, which also pushes on the optic nerve, and at the end of the day, the person may also develop glaucoma. So our footballers, other people who also engage in fights and other things, someone hits you, you don't even seek treatment. At the end of the day, there's build-up of pressure, and then if care is not taking it, kind of impede on the optic nerve, pressure generates, and then there's deterioration, you get glaucoma.
So how is this serious when we come to Cape Coast, I mean in our region, Central alone?
To add up a little, we also have people who will not come to the hospital when they have an eye problem. They prefer going to the drugstore or pharmacy shop to get something for their own use. Most of the drugs contain steroids. So regular use of it can also increase the pressure. We are not saying that don't go to the pharmacy shop, but even when you use it, try and come to the eye clinic.
You go with prescriptions and stuff?
Mostly don't go with
people
prescriptions.
don't go, yes.
So when you come, we'll give you the right diagnosis and then the right treatment. You take a prescription and then you go and buy your drug.
Oh, okay. Like I was asking, I wanted to know how serious this condition is when you come to Central Region.
Yeah, so it's very serious. When my brother was talking, we were talking about the prevalence rate. Okay.
In Ghana.
Ghana. Yeah. So Ghana, when you look at people who suffer blindness, okay, 19%. So 19% of these people, they suffer blindness because of glaucoma. Okay, some people are blind. They come, and then when you screen them, you realize that this blindness is reversible. You can reverse it. Example is cataract. One day we'll come and then talk about cataract. But when somebody comes and then it's cataract, that one you can reverse it. You do the surgery and then the person gets his or her sight back. But glaucoma is not like that. We talk about the nerves being damaged. When nerves gets damaged, you can't repair them. So that makes glaucoma very, very serious. And then it doesn't have any signs that you will get. If you
I'll come to
Yes.
I'll come to that. But before that, I was going to ask whether we have early warning signs. So you can continue from there and tell us if we have any warnings, because from where you are starting and my question,
All right,
it seems
thank you.
there.
All right, thank you. Yeah, so what we're saying is, glaucoma doesn't give you signs. Okay, when my brother started speaking, he said that we are supposed to see at an angle, okay,
180 degrees.
180 degrees. So your peripheral visions you are able to see, but you see, we don't pay particular attention to our peripherals. Somebody will tell you, me, I can see from afar. Or if somebody is coming from afar, I can see it. Okay, for your central vision, yes, if you have glaucoma, you can see, but your peripheral vision, so glaucoma starts damaging your nerves from the peripherals. So it will damage your peripherals before it comes to your central vision. But that time is getting to the advanced stage. So when you are lucky and then you come to the hospital, mostly people don't come to the hospital because they have glaucoma. They will come, oh, I'm having tearing, my eye is itching, and all those things. But when they come, you take that advantage and screen them for glaucoma. So we screen them, look at the back of the eye, and then you are able to diagnose that, yes, indeed, you have glaucoma, and then we start the treatment.
So, with the signs and symptoms as well,
Yes.
you see, it's asymptomatic, as he said, because usually it affects peripheral vision. And most of the times when we are looking at something straight ahead, even if I call you and you are on my right, I will just turn my head and then, or you turn your head and look at me. So it's very difficult for you to notice that you have glaucoma. However, the other forms of glaucoma, which maybe the patient can also notice, like those with angle closure glaucoma, for them, because of the severe pain they experience, they can quickly come on and tell you that, oh, I have pain. There's severe pain because maybe I experienced some sort of trauma yesterday and there's so much pain. That one the patient can come with symptoms. But with a normal open angle glaucoma, they come with no symptoms because it affects the peripheral vision. Already some people are looking straight ahead. You call him, he will turn his head towards you. So there is nothing like they noticing any changes, except it's developing to the medium or the moderate stage, and then to the advanced stage. That's when they notice that, no, it seems when things are at my peripheries, I can't see them clearly, or when it gets to those stages, that is when they can tell you that there's something happening. But at the early stage, no. It's like you have a big farm and then you go, maybe one grass cutter has come to take just maybe one maize out of it. It will be very difficult for you to notice it. That's what happens in glaucoma.
But you also made mention of genetic factors. I want you to tell us, how do those factors influence the risk of developing glaucoma? And again, what role does family history, play?
All right. So there's a study that has shown that we usually carry certain genes. There was a study that was being conducted by Professor Bodikusi of UCC, where one of his students was working on the family history. I've not really followed that study yet. But then when I was there, I noticed that, so all patients that were coming in, if I have glaucoma, then all my lineage, my family members, they come, they have an OCT done to check what exactly is happening. So there is a study that's saying that once someone has glaucoma in the family, there's high possibility that all the family members will have it. And specifically those of African descent and then Asian descent, there's high possibility that we are going to develop it. So yes, there's genetics, but there are studies ongoing that definitely will come and prove to us. I'm hoping to read on what Prof. Boedikusi is doing, and then maybe the next time we meet, we'll discuss.
I'll be glad to hear that. And also, what you also said was about the pressure. But I want to know the connection between high eye pressure and glaucoma, and how does it lead to the vision loss?
Let me take that.
Okay.
All right.
So we are saying that the high pressure is as a result of a fluid, that is the aqueous humor. We have a fluid in the eye that is called the aqueous humor. Under normal circumstance, this fluid is produced every now and then continuously. And it's supposed to, as it's produced, it's supposed to come out. This fluid contains the nutrients that nourishes the eye. And so if there's a problem with the production, or there's a problem with how it's supposed to exit, we have where it's supposed to exit and where it's being produced. So if it is being produced normally and it's not able to exit normally, the exit is blocked. That is when we have the increase in the pressure. This fluid builds up and then it becomes increased in the eye. And so when it is not attended to, as we are saying that we don't have any sign, we don't feel any pain, we don't feel anything. So as time goes on, it builds up and then starts damaging the nerves. So that is what amounts to the increase in the IOP, that is intraocular pressure. That is what amounts to it. And then we have the types. Sometimes there's a total blockage, that is the chronic type. And sometimes too, it's as a result of a particle. As when my brother was talking, he was saying that sometimes somebody might get a trauma. If someone gets a trauma, in the course of the bleeding, a particle may just enter into that angle and then it gets blocked. With that one, when we are able to take that particle, there will be a normal flow. But if it is blocked, there's nothing that we can do. And mostly when it is blocked, you are not able to see any sign until it gets to that stage where the nerves are damaged and then you can't see.
That particle can enter.
Yes, please.
Okay, so to add up, so for the layman, okay, for the layman, one illustration that we can use for this pressure is a tap water and then a sink. Okay, you have the sink. If you have a sink and then there is a particle blocking the sink, okay, you realize that once the water is coming, we're talking about the exit, okay, it means that it can't exit. So there will be that build-up of the fluid in the sink, which impedes the flow. Okay, so for the layman, then it means that once there is going to be that build-up, the pressure in it is going to increase. So even if there is a small exit that it can pass through, it can't flow freely as it's used to. So you realize that there will be that kind of build-up, okay? And then once there is going to be that build-up, the pressure will increase. And once the pressure is increasing, it means that it's putting pressure on the optic nerve, which damages the nerves, okay? And then once the nerves starts to damage, then it means that your vision gradually also decreases.
Sometimes when a particle gets to the eye, you see some people, for your brain, that kind. Is it proper? Is it proper to do that?
Yeah.
Is it proper?
But it wouldn't have any effect with the glaucoma.
Okay.
Yeah.
But with a normal foreign body on the eye, you can wash your eye, because mostly when they come, we also do the irrigation.
Okay.
It's the emergency, fast emergency thing that we normally do before we make any diagnosis or assessment or whatever.
That's
we
good.
give treatment.
But you see, when someone develops this condition, certainly it will impact or affect the person's life or daily life. So how does it impact life, and what adjustments, may be necessary?
It's a blow. It's a serious blow for most of our patients when they come and then we tell them they have glaucoma. Some deny. I think they come into that denial stage until for some time before they are able to adjust. Mostly, some get their diagnosis outside. They get some sort of information, a first diagnosis, before they can say that, no, I want a second opinion. And then they will come, and when we do our test, we explain everything, we show everything to you, we confirm before they accept. It's a blow. Most of the time, it's however you may see it, it's a blow or a challenge, because just waking up one morning and then you are being told this is the condition that you have, it's irreversible, and you are going to be on these drugs for your life.
Do you tell them that can lead to permanent loss?
Yes.
So that is why they are unable to cope or accept.
What we normally say is we explain the condition to you, and then we let you know the extent of damage that you can go through if you don't use those medications. Because the medications are there to reduce the IOP. So if you still be in the denial stage and say you are not going to use the drug, the more you delay, the more the pressures go up. And then the more the nerves too are damaged. And the higher your vision reduces. So we encourage them. For us, we open up. Most of the time they come and they say, I had a patient who came in and said, I was diagnosed 5 years ago. When they told me, when I did the scans and everything, they said it's only the eye pressure that was up, so the nerves are not affected. So he was discharged. He wasn't given any treatment. But 5 years later, he came back and it's gone. The right eye is like 75% gone. And then the left eye is maybe 50%. So ours, what we do is we let you do the labs, the scans and everything. We keep it. And then we encourage you to come a year. You do the same lab, the same scans and everything, and then we compare. If there's a change, and then we put you on the drug. If there's no change, we continue monitoring, so that if there's anything coming up, we are able to catch it up.
All right. So with the impact on the person's daily life, you see, one, before you get the medications, you may have to buy if you are not on the NHIS. And even with the NHIS, it's not all the medications that it covers. Depending on your stage that you came in with, there's other medications we may have to prescribe. So if it impacts on your activities of daily living, definitely will also affect the quality of medications you are going to use. Now, it also affects your mobility. Your peripheral vision is gone, so some patients will be bumping into stuffs. Let's say we have a table in front of me here. The patient can't see that there's a table in front of him, so he will bump into it. Someone who was previously driving, doing things on his own, now comes in with blurred vision, peripheral vision loss, and all of a sudden, because of glaucoma, the person should stop driving, and all of these would definitely affect the family finances. Imagine that the person is the breadwinner of the family. It will really be a deep blow to the family. Some people, the moment they are told that they have glaucoma, I think one time when we were doing our clinicals at Bremane Sikuma, there was a patient we realized has glaucoma, and he came in thinking that, oh, once I am going to the hospital, there's definitely going to be a magic that will be performed for me to see again. And unfortunately for such a man, he was diagnosed with glaucoma, and it's irreversible, as we said early on. What that just man said was, then it's better he dies. You see the psychological trauma that it comes on with. And the other patient who also love reading, now the peripheral vision is gone. It's just left with some sort of tunnel vision left, and also going to have effect on whatever he or she is doing to survive. if we get to these advanced stages, there are other forms of things that we can do, where we kind of start with the low vision assessment and then low vision training, the visual aids that we can give to such patients. Our friends at the School for Deaf and Blind, the School for Blind just behind us, they go through series of training in order to adjust themselves to such life. The moment you have glaucoma, that doesn't mean that is the end of life for you. We can reform you and then make good use of whatever vision you are having. So
It's
it's sometimes
difficult.
very difficult for them to accept
Yes. Very, very
psychologically, because maybe a day or two before it happened, you were living your normal life, but maybe just yesterday you were fine. Today you can't mean complaining that yesterday I was seeing, today I can't see. And we tell you it's glaucoma, it's irreversible. Look at the kind of psychological trauma you have to go through. Probably you may also have to go through the counseling section and other things, which may also come at a cost. So all these kind of affect or impact the life of the individual.
All right, so yeah, to add up, so one thing we encourage them when we are counseling them is, though you've gotten the glaucoma, you've been diagnosed of glaucoma, but then the drugs, the medication that we are giving you, it slows the progression. Okay, so people shouldn't get scared, they shouldn't be worried. If you come early, okay, or if it's in the moderate stage, we have so many drugs that we use. Okay, so the drugs will halt the progression. That will not let you go blind. Get it? So if you come, we encourage you that we are giving you medication. But then what we also realize is some people do something we call medical shopping. If you come to hospital A and we diagnose you as having glaucoma and we start the treatment, it's better you maintain that hospital and then we are able to monitor the progression. My sister was talking about scans, series of scans that we do. Once you are doing the scan, you are using the medication, you are using the scans to also monitor the progression. Okay, but if you move from one hospital, some you give them medication, they will not use, they want to go and seek opinion in a different hospital, they are not even using the drugs. So once you go to a different hospital, then they are going to start everything again. Okay, then it means it's even becoming burden to you. You are going to do series of scans again and it's going to affect your finances. Okay, so if someone is diagnosed of glaucoma, they should stick to a particular hospital, even if it's two, or they should just stick to that hospital so that we know their history, we monitor their progression, and then that part of you going blind will not happen.
You are still watching Cafdil Healthcare on Cafdil Television. I'm hoping that you continue to follow us on our social media, that is Facebook and also on YouTube. Like and share at the same time. So how often should people get screened, for glaucoma, and at what age should they start? Okay,
so what we encourage people to do is at least, even if you are doing once a year screening, it will help us pick some of the early signs. And then we are not even look at ages. So because of when we started, we said that it affects children too.
Yes.
So now we also do school screening as well. We go to the schools and then we screen the children for, aside we screening for other conditions, we screen them for glaucoma as well. So now we are able to detect some of the signs very early, and we encourage people that at least once a year, get yourself checked, and then you're able to pick those early signs.
Once a year, is it everybody?
Everybody, whether you have any eye condition or not. Glaucoma will not, the common ones that we have here. My brother said some of them, the other types, those ones you can have pain in your eye and then you will come. But the common one that we have in our setting here, you will not have any sign. So if you come, we can see. Okay, whilst you are sitting there, you cannot see whether you have glaucoma or not. But when you come to us, we use our instruments, our machines, and then we can see, detect it early, tell you. We we don't just even do one particular test. We do a series of tests before we are able to confirm that yes, you have glaucoma, and then we put you on the treatment.
Health insurance cover that?
Some of them, just some few.
But is it expensive?
Yeah, glaucoma treatment is.
I mean the screening.
The screening is free. Once you have health insurance and then you move into any government eye clinic, we screen you for free. It's free.
So I can just come with my health insurance. I'm
coming
to screen for glaucoma. Oh, okay.
You are just coming for eye check.
Eye check.
Eye check, and then we will screen you because there's no glaucoma alone. Okay, we don't have glaucoma alone. You have different kinds of conditions. But then when you come and then we screen you, we can pick so many different eye conditions.
And our brothers and sisters who are about 40 years, I think for them, maybe every 6 months would do. And those with family history of glaucoma too, they should also be doing that every 6 months. However, with the, you said, does it come at a cost?
Yes.
Okay, so those who have family history may come at a cost because you may have to go and take some scans. The OCT will come at a cost, the VFT may come at a cost, the pachymetry would also come at a cost. So all these scans would also help in analyzing or coming to a common agreement that yes, you have glaucoma or you are still a suspect of glaucoma.
All right. So what are the treatment options?
Okay, we have drops, like eye drops that we give, and then we have some orals too that we give. Depending on the pressure of the eye, we give the drops, and then if it's severe, we add up the orals. And then mostly we have surgeries, but mostly the surgeries are not, we don't, I would say, it's a later
part.
Yeah, later part of it. After we have used the medications and then the counseling and whatever thing that we have to do, and it doesn't work, then we go for the surgery.
What about the laser
surgery,
therapy?
Yeah, we have laser therapy too. And then the surgery too is not 100% guarantee. So mostly, yeah.
You see, one of the only modifiable factor in glaucoma management is the IOP. So if the, as you said, medication is the topical one, that's the eye drops, and then the systemic, the one we take in, depending on how high the IOPs are. If we realize that...
What is the IOP?
The intraocular pressure, sorry. So depending on how high it is, and even with medications, it's not coming to the normal being 11 to 21. You are still way above it, maybe 40s, 30s. Constant use of medications. However, there are some patients you realize you give them medication, you advise them, but then you go home and then still not use it. After constant use of these medications, we are not really achieving any target. That's when we go in for such surgeries, with the hope that it will bring down the IOP to the normal, within the normal range, for the patient to be fine. However, as she said, if still with the surgeries you are not getting there, you continue with your medications as well.
It's not easy, which means the treatment like those eye drops, the surgeries that you made mention, how do you compare, in terms of effectiveness and side effects?
They work, but then it also depends on patients. You are unique than my brothers and sisters here.
Yes.
We are all different. The way you may be using your medication, even after giving you much information on it, might be different from how Prince will be using his, as well as Sister Marian will be also you'll be using her medications. And maybe some sort of your systemic conditions may also prevent you from using some specific medications that would be prescribed to you. So all these coupled together would determine whether or not you may need surgery, or whether or not you go blind.
That is what when I hear then, it's just like you have I'm imagining when he said that you said that they will be coming together and So I was imagining my television getting cracked, and you see the ink coming close. So it's not
mostly
easy.
the medications work. As Doc was saying, depending on the individual, for all you know, the individual is not adhering to the medication.
Okay.
You see how glaucoma is. If you don't take care, you relate it to be spiritual. It doesn't
So
give
I was going
any
to ask that, do you have myth about this?
Yes. It doesn't give any sign. So most of the time, a client will come, oh, then once maybe try menu more. Menu no call. So when you do the assessment and you tell the patient this is what you are going through, no,
once one is a spirit.
So
before they will come back, they have gone through so many places, doing shopping, medical shopping, going to pastors. We are not saying that the pastors or the spiritual aspect is not there. It's really there. But as we work physically, we also work spiritually. So if you are diagnosed, just come. Take your medication. That is why God has given the pharmaceutical companies and the pharmacists knowledge to do these medications. So whilst we are praying, we are also applying. And the topicals and the orals really work. They work. So most of the time, we don't recommend the surgeries. It is only in advanced cases. And let me say, if we take like 10 over 10, it's only 1% that will, or 2% that will go for surgery. The medications really work if the patient will comply with the medications that we give.
One painful aspect of this glaucoma management is you diagnose your patient, maybe as she said, a patient will come with early glaucoma. You do all the talking, looking at the pile of patients at the OPD for you, but then because you've seen someone with glaucoma, you do all the talking, explaining things to the patient, how to even use the medication in order for the condition not to progress to the end stage. Now, the patient leaves your office. You gave maybe a review date in a month. 1 month, Auntie Mansa didn't come. The next 2 months, oh, what happens? Maybe you follow up with a call. Oh, Doc, my bad eye. Remember, you see Auntie Mansa in 3 years' time. Auntie Mansa will be held by the hand. So the grandchild will be holding Auntie Mansa's hand to your consulting room. Auntie Mansa, what happened? My pastor said that I went to the spiritualist. To be honest, these are disheartening, and when it happens, they think that that's the point your book knowledge or your clinical skills comes in for you to regenerate the nerves that is gone. No, we can't do that. If they, as she said, you may have your beliefs, but at this point, kindly stick to your medications. Use them. You can follow up with your other beliefs as well, but please, when it's time for you to come for your reviews or your refill of medication, please come for them and adhere to the treatment. There is this thing we heard that a patient was given some antibiotics to be taken at a particular point in time, and then the patient took it earlier than that and says he was surprising the bacteria. You don't surprise the glaucoma, no. So if it's a 12-hour regime medication, if it's 6 a.m., it's 6 p.m., not 6 a.m. and then 7 p.m. was 8 p.m. No, you don't surprise anything here. You are surprising your own self. Because at the end of the day, you think that we've given you medications, so you'll be fine. Meanwhile, instead of you doing your 12 hourly, the person is rather doing maybe 13 or 14 hours, thinking that they are surprising whatever they want to surprise. No, that doesn't happen.
And then adding up to the myth about glaucoma, I was counseling a patient just last week. And then I realized the patient's own was moderate. It's been there for some time, but the person didn't know. And I was asking him, why didn't you come early? I said, oh, Dr. Amize, Edruna why more? What frame there munkozi hin? And I'm a monko. Into Morocana na bibi po menuado. She bibi bo menuado and I make her dance as a Baba hospital now. I say, Inti, Oba and I are showing who they are. Then you are even lucky that they asked you to go, because it has helped you come to the hospital, and then we're able to see it. Then we start the medication early. We have so many types of medication. So one medication that will not be good for you would be good for somebody. So if you come for review, we check your IUP, your pressures, and then you compare it to the medication that you are using. If there is the need for us to change some of the medications, we will change it, and then you'll be fine.
Can this be prevented, and if so, how?
Yeah, so glaucoma, when you started, I stated that glaucoma is not like malaria that you get it, we treat you, and then you go. We don't prevent glaucoma, but we manage. We manage. So when you get the glaucoma, we diagnose you of having glaucoma. We put you on medications like diabetes, hypertension. We put you on treatment for life. So it slows down the progression. So instead of you going blind along the way, you realize that your nerves, where you've gotten to, we are able to maintain it, and then you don't go blind. So we don't prevent glaucoma. We only manage, yes.
Hey. The nerves, are they connected to the back of your head?
So they connect to the brain.
To the brain?
Yes. The optic nerve.
Okay, so can something hit at the back here and affect your eye?
Yeah, so it can hit. So we talked about trauma. Yes, trauma, you can get types of glaucoma. You can get glaucoma out of trauma. Yes, but those ones, they are just few instances. What we have in our setting is the primary open angle. That's what is common here, yes.
You celebrated Glaucoma Week. What was the theme?
Uniting the world
for glaucoma.
For a glaucoma-free, for a glaucoma-free day.
You have it in your
yes, uniting for a glaucoma-free world.
Glaucoma-free world.
Oh, okay. And is it possible?
Yes. So glaucoma, we all come together. Okay, we are there. You go and do screening. We are advising our cherished viewers, our listeners, to come for checkups. Okay, so it's partnership.
Okay.
You come, we also screen you, and then so that's why we say that uniting together. We all come together, and then we can't eliminate glaucoma, okay, but we can halt the progression of you going blind. That's why you always have to come together, and then.
Yes. So that was the importance of the celebration.
Yes, we can't get a glaucoma-free world, but with early screening and then early detection, we can avoid any blindness that can come with glaucoma.
Our time is up. So what advice, let me start from you, Theo. What advice would you give to someone, as you said, when you are being diagnosed, it's difficult to accept that. So what advice would you give to someone who has just been diagnosed with glaucoma?
Stick to your medications. Report to the hospital whenever you have any side effects. If you have any questions, please come to the hospital. Ask your clinician. Let them explain things to you. Usually it's best for them to explain what is happening with your scans. They would even explain, we will explain what is really happening to you, whether you are the mild, moderate, or severe stage. We explain everything to you. So whatever be the case, even if it's at the advanced stage, please come. Continue your medications. If we need to orient you with other low vision aids as well, don't worry, you'll be fine. We have other blind people who are doing very well in society. That's not the end of their life. We hope that in the new world, we all see again.
Marianne?
I will also say that glaucoma is not a spiritual condition. It's a medical condition.
Is it one small but you in there?
I was a bra. Come. When you come, we take your medication. You are diagnosed, you take your medication. Just pray over the medication, and then it will work perfectly for you.
Friends?
Okay, so I'll also advise our viewers not to be buying over-the-counter medication. If you have any eye condition, just walk to any eye clinic around you, and then we are there to serve. Okay, and then we shouldn't also do medical shopping. Once you are diagnosed of glaucoma, please visit your clinic, or if you travel, visit any nearby eye clinic, and then when you are going, go along with your medications, your scans, and they will also treat you very
This
well.
one, just a quick one. You made mention of myopic, isn't it?
Yes.
What about those who are hyperopic?
They also have the possibility of developing angle closure glaucoma.
Okay.
So the myopes have the open angle, but then the hyperop are going for the closure.
Okay.
With the advancement, we are hoping that in the new, maybe the advanced world, they have it. They have this sustained drug delivery, release drug delivery, where they implant some sort of medication on the eye, and instead of you going for your routine eye drops, with time, because of how the medications are used, it releases the component onto their eye. We hope Ghana maybe will get the some sort of within the new
Digital Ghana, new digital Ghana.
we hope so that one day we'll get there. But then if you have the chance to travel outside, some people are using it, and it's very effective. We hope one day, as I said, we will get there.
Yeah, I appreciate all of you for coming. Thanks so much.
Thank you.
And thank you to all the crew. You heard Prince Fianco is an ophthalmic nurse. Hey, your word there. Then yes, then Marian Ehun Arthur, ophthalmic nurse also, and Theophilus Otri, optometrist. Hey, Cape Coast Teaching Hospital. My name is Kojo Arthur. Thank you for watching. Thanks to all the crew. Same time next week. Stay blessed.
Mojo.